mean, advocacy for rare diseases is everything. It's really the only way to get through and to allow for the awareness to come through so more companies can devote research and time in rare diseases. I think advocacy is also key to shortening that time of diagnosis. I think diagnosis in rare diseases can be really, really painful emotionally and physically, long, and length can add to the complications of the disease even further. So I think advocacy plays a really huge role in having someone that owns the disease space and pushes people to care about that disease space. It's also something that obviously brings all the patients together, because honestly, the biggest challenge in rare disease space was the individuality of things. And until people come together and smaller unit becomes something bigger, it's a harder thing to move. So advocacy plays a key role in that. Struggling to find diagnosis. They know something's wrong with their son. It's been, 5 years now, and they just keep chasing to figure out what's wrong. I think part of that is that a lot of rare diseases are symptoms that don't quite add up. And so you're not dealing with just one specialty, but you're dealing with multiple specialties. And it's not easy to connect all of the specialties together. No one's really talking to one another. So then the advocate and the parent and the caregiver becomes this person who has to connect all the dots, who has to be the owner of the information, the pusher of information, which takes time. They become sort of these doctors themselves. But I think the diagnosis has a lot to do with education, a lot of absence of disease materials, and physicians not always understanding. But I think it's a bit of a mindset too. I think typically physicians are trained to not look for zebras but horses. It's a phrase that's been used very many times. Rare doesn't really come to people's minds as quickly as something more common, which adds up to the time. There's a lot of stigma. Sometimes patients and caregivers are assumed to maybe have emotional issues or psychological issues, which is why they keep coming back to the doctors with these problems, when in reality there's something actually really wrong with the patient. So I think the diagnosis is the most painful part. And what we work with our clients to do oftentimes has to do with closing that gap in diagnosis, which is creating materials and tools to help caregivers and patients and doctors connect the dots quicker and be able to sort of help them understand how when you Google something symptomatic or something really random, how do you find the right answer and how do you connect with the right doctor at the right time? You have the ones who diagnose you, then you have the ones that actually treat you. Those could be two very different doctors. How do you get to the right doctor at the right time?